Hello everyone and welcome to our second video in RRK question series. And Yusuf, today we have a really special question because this was present in one of the most famous Q banks for the step and only 29% managed to get it right. So are you up for the challenge, man?
Yeah, let's go. So before we start solving, we'd recommend that you guys give this a try and resume the video. Alright, so here we have a 32-year-old man that is brought to the ER after an episode of syncope. He has felt weak and has not eaten much over the last week. As a result, he believes he's dehydrated. The patient is an IV drug user. That seems like an important point, kind of points toward infective endocarditis. And was hospitalized for aspiration pneumonia 3 months ago. Again, his temperature is 38.5. Again, points toward infective endocarditis. And his blood pressure, what do you think of his blood pressure?
So here's the thing, his diastolic is really low while his systolic is normal.
Yeah, that's right. So that means his pulse pressure is high, right? The difference between systolic and diastolic. So that seems like an important clue. And look at his pulse.
That's really low.
Yeah, definitely. And the oral mucosa is dry and dentition is poor. An early diastolic murmur is heard at the left sternal border at full expiration. Now, this is one of the most objective statements we have in the question stem so far. So to me, this is like the most important phrase or sentence in the entire stem. And usually we start reading the question, like the last line of the question stem, right? So this is where I would have started. And in my opinion, this is the most important sentence so far. Then we have the lungs are clear, right? And the abdomen is soft and non-tender. Again, needle marks are seen on the left arm, shows us that he's an IV drug user. And ECG shows a sinus rhythm with 2 to 1 second degree AV block. So this basically means that after every other P wave, a QRS complex is dropped, right? So okay, so let's look at the answer choices. So what do you think of Lyme disease?
Okay, if I had only 30 seconds left and I only read the very last sentence, I'd go like, oh, AV block, so I might actually go and pick Lyme disease.
Yeah.
But that's not why can't it be Lyme disease?
Alright, so first of all, he doesn't have the other symptoms of Lyme, the skin manifestations, the areas that are more likely to have exposure to Lyme disease. So that's how I excluded it. I mean, there aren't any other symptoms that point toward Lyme disease other than the AV block, and the murmur just completely pointed away from the diagnosis, and the fact that he's an IV drug user as well.
Exactly. So if you pick that, pause and try again.
Yeah, and acute pericarditis. So, okay, the thing about acute pericarditis is that you'd have a positional chest pain that improves with leaning forward. We didn't have any complaints of chest pain here. We just had a murmur and an AV block. Neither one of those is found in acute pericarditis, right?
Yeah, that's far away.
Yeah, so we eliminated those two so far. And then we have tricuspid endocarditis. This seems like a very good answer choice, right?
It does. IV drug user, very common on the right side of the heart. Why is that the case?
Yeah, because of course, if you're an IV drug user, you inject through your veins, and then the veins empty into the right side. So if you have anything that's infected, usually the tricuspid is the first valve that meets this infection.
And it causes regurg, right?
Yeah, and you'd get tricuspid regurgitation. So that's another thing that made me exclude this question, because again, as we said, this sentence over here about the murmur is like the most objective statement. And in tricuspid endocarditis, you'd have tricuspid regurgitation. And yes, it could be at the left sternal border, or it would be better if they said left lower or lower left sternal border, right? But the thing here is that this is an early diastolic murmur, right? In tricuspid endocarditis, what's the type of murmur we get?
It's hollow systolic.
Yeah, exactly. So, and also not only that, this murmur that they're talking about in the stem is heard best at full expiration, right? But what about the murmur in tricuspid endocarditis?
Inspiration.
Yeah, exactly, because when you inspire and you decrease the intrathoracic pressure, this sucks up more blood into the right side of the heart. So this would increase the right-sided murmurs like tricuspid regurgitation. That wouldn't be the case in here because, okay, now this would actually bring me on to the next answer choice. So, perivalvular abscess. Now, honestly, when I looked at this question stem, I was like, okay, this seems like infective endocarditis of the aortic valve, right? But it's not in the answer choices. And when I saw perivalvular abscess, I was like, okay, they didn't specify which valve.
Yeah, that's
So
true.
I ended up picking this one because it could mean that it's the aortic valve. And the thing about the aortic valve, okay, look at this picture over here. Look at this diagram here. Okay, so if you could look at this diagram, you could see that the aortic valve is very close to the AV node or bundle of His, right? Because the AV block that we have here sounds like it's infranodal, below the AV node, and that would be very close to the aortic valve, right? So if you think about it, if you have a perivalvular abscess of the aortic valve, this would not allow the cusps of the aortic valve to close properly, right?
Yeah.
So you'd get regurgitation,
Yeah.
right?
Yeah.
And since it's close to, since the bundle of His and the AV node are close to the aortic valve, what do you think could happen to them?
Oh, it could block it, like it could, like
Yeah,
the abscess
exactly.
could block
It could
the...
spread and block the
Yeah.
conduction. So you'd get this. It would explain the AV block, and it would explain the murmur we have. And I think those two are the most important statements in the questions. And the other things are a bit vague. Syncope, weak, IV drug user, fever, right? And the blood. Oh yeah, the blood pressure again. Yeah, that's also an important point. So when I asked you, you pointed out that it's the diastolic is low and the systolic is normal, and so we have a high pulse pressure,
Yes.
right? So in aortic regurgitation, you get a high pulse pressure, right? Because
Yeah.
during diastole, when the ventricle relaxes, blood flows back. Okay, look at this diagram here. The valves are not closing properly, so blood is going to flow back to the ventricle during diastole. So there is less blood inside the aorta, and so the diastolic pressure in the aorta becomes low. So the diastolic decreases.
Well, the systolic is not affected.
Yeah, exactly. If anything, you could actually, in severe cases, you could get isolated systolic hypertension because the regurgitated blood that comes back into the left ventricle increases the preload or the end diastolic volume you have in the left ventricle, okay? And so, according to Frank Starling law, the contractility would be greater and the stroke volume of the left ventricle would be greater. So during systole, more blood will be pumped out of the ventricle. And so the systolic blood pressure could actually increase in severe cases, but this was not the case in here.
Okay.
Right? So usually, in milder cases, you'd have the diastolic pressure would decrease, like in this patient. So this makes perivalvular abscess the correct answer choice.
What about mitral valve prolapse? That's excluded for 6 complacency.
Yeah, so mitral valve perforation, what do you think? Where would you have a murmur if it's a mitral valve problem?
It will probably
location.
be over the apex.
Apex, yeah, we didn't hear anything over the apex, right?
Yeah.
So this is how I excluded it. And if it's a perforation, it would probably cause what?
Mitral regurgitation.
Yeah, so it would be probably holosystolic.
Yeah, so also
Right.
far away.
So yeah, I think this sums up the important points. Thank you, everyone.
Yeah, and if that was a question on the real deal, it's like because most
Yeah.
of the students ended up picking like tricuspid endocarditis, like 60%.
Yeah, more than 60. I think it was like 65% picked
Yeah.
tricuspid endocarditis. So yeah, sometimes you need to carefully analyze certain statements of the question stem. And in this question stem, honestly, the way I approach this is I tried to find the most objective statement they have here. Like, you can't go wrong with an early diastolic murmur. And an important point here is that diastolic murmurs are usually pathologic, right?
Yeah.
So if they said like you have a 1 out of 6 systolic murmur, this could be something benign. Like, it's not something that would go like, oh, this is an objective statement, let me analyze why we have this murmur. But in this case, they said diastolic murmur, and diastolic murmurs are always pathologic, right? So you cannot go wrong with this statement. You have to make something out of it,
Yeah.
right? So I think this was the most important point in this question.
So great job, man. What a hell of a question. And thanks all for having us walk through it.
Thank you, and thank you everyone for watching.
See you in another video.